Welcome back. In this video, we are going to discuss about the infections of individual pelvic organs. The objectives of this session will be the vulval infection. This series will contain 10 parts. In this today we'll be dealing about the vulval infections and the remaining topics in the other parts of the videos. Vulval infections. To understand the vulval infections, we first need to know the anatomy, what is vulva and what it contains. The vulva will include the mons veneris or the mons pubis, the labia majora, the labia minora, clitoris, vestibule, and conventionally the perineum. To understand each of the part in detail, you have to watch the anatomy of pelvic organs which we have uploaded in the previous session. So guys, you can see here they are talking about the labia majora, labia minora. So the labia majora, the minora, and the mons pubis, vestibule, and also the clitoris. Okay, so these parts together will include the vulva. Any infection in these sites is regarded as vulval infection. The vulva and the perineal skin, it will usually be resistant to the infections which are occurring commonly, but once the defense is lost, there will be irritation by the vaginal discharge. This constant irritation could be either because of the vaginal discharge or also because of the urinary incontinence or the contamination which is occurring there. Furthermore, there can also be the vulval infections because of the atrophy or the degenerative changes which is occurring in diseases or in the menopause. The vulval infection will occur directly, or it can be secondarily because of a primary site of infection elsewhere in the adjacent structure. It could be the anal canal, or it could be the rectum, or the adjacent structures can have the infection. So guys, you have to know the anatomy. If this is the vulva, the uterus, the cervix, the vagina, and the vulva. So we have the urinary bladder and the urethra in the front, which could be an adjacent structure. Behind we have the rectum and the anal canal, anus. So it could be either the infection of this or this. Any adjacent structures, this infection can result in the vulval infection. It is secondarily. Hope it is clear. It is because the defense is being lost and the constant irritation which is produced by the discharges and urinary incontinence. So it is indeed very difficult to classify the vulval infection, but this etiological classification could be of help to us. It is classified based on the specific infection or due to the sensitive reaction or because of the vaginal discharge or urinary contamination. The vulvitis due to the specific infection. Here, the specific infections could be the sexually transmitted diseases. Those are the infections which are transmitted through the sexual contact from an infected partner. These will include the gonorrhea, obviously, which is caused by the Neisseria gonorrhea. Then we have syphilis. Then we have chancroid. So the chancroid, here the syphilis is because of Treponema pallidum, as we know, and then we have the chancroid. The causative organism here will be Haemophilus ducreyi. What happens in this chancroid? The lesion will start as a multiple vesicopustules, and these multiple vesicopustules will occur on the vulva, vagina, and the cervix, and then this will slow off to form an ulcer. This occurs in the chancroid. Then we are talking about the lymphogranuloma venerum. The initial lesion will be a papule. Then it is transforming into an ulcer or a pustule. It is occurring in the vulva. Obviously a vaginal infection. These can also occur in urethra, rectum. So guys, the bubo formation will also be there in the lymphogranuloma venereum. Then they're talking about granuloma inguinale. In granuloma, the lesion will start as a pustule and then it will break down, and it is going to cause the erosion of the adjacent tissues through the continuity. You getting it? So these are the sexually transmitted diseases which are causing the vulval infections: gonorrhea, syphilis, chancroid, lymphogranuloma venereum, granuloma inguinale, and tubercular. So tubercular is nothing but the tuberculosis. So the causative organism is Mycobacterium tuberculosis, the genital TB. This can cause a vulval infection. Then we have the viral causes, that is Condylomata accuminata. So this Condylomata accuminata, they are the papillary lesions which is caused by the human papilloma virus. So the Condylomata accuminata is by the human papilloma virus. Then we have the herpes genitalis, molluscum contagiosum, and herpes zoster. So in the picture I'll explain you. So you can see this Condylomata accuminata, the lesions which is caused by the HPV virus. It is specifically the virus type 6 and 11. Okay. Then we have the herpes genitalia. Initially we see the red papular inflammatory area which is appearing on the clitoris or the vestibule, all the parts of the vulva, and then it can also occur in the perineum. These multiple vesicles will progress to form ulcers. So this is herpes genitalia. Then moving on to the next type, we have the molluscum contagiosum. Molluscum contagiosum will be caused by the pox virus. It is transmitted through the use of the towels or the body contact with the infected person using their clothes. So this is molluscum contagiosum. So you can differentiate now guys. This is Condylomata accuminata, herpes genitalia, molluscum contagiosum. You need to know the causative organism in each and also how the lesion is appearing. Then we have the herpes zoster. The causative organism is zoster virus, varicella zoster. So in the name itself, herpes zoster. So we have varicella zoster virus, herpes zoster by varicella zoster. So you can see the typical presentation here. So what happens in this? An inflammatory eruption which is going to be very painful, and then there is group of vesicular formations, and this is occurring on the skin, and it is also going to follow a peripheral sensory nerves, the dermatome. So the dermatome is the area of a skin which is supplied by the sensory nerves which is arriving from a single nerve root. When do we call it as a dermatome? When the nerves which are supplying is arising from a single spinal nerve root, then we call this as a dermatome. So the herpes zoster is occurring across a dermatome. And then moving on, they're talking about the fungal infections, that is moniliasis and ringworm. Moniliasis, this is caused by Candida albicans. So obviously the fungal infection monoliasis by Candida albicans. This is a gram-positive fungi. So you can see the typical presentation of monoliasis. Then the ringworm infection. In ringworm, so this you have to see the worm. Okay, I guess there's no picture, it will come up in the upcoming slides. This is a ringworm infection. Then we have the parasitic infections. In the parasitic infections, we have the pediculosis pubis, scabies, and threadworm. So in pediculosis pubis, so guys, this ringworm, first we have to know about this. This is caused by Tinea cruris. The lesion is bright red and also the circumscribed lesion can be seen. Then they're talking about pediculosis pubis. It is caused by this like the lice which is seen in the hair. Okay, similarly here the crab loose The crab loose is also known as Theris pubis. It is affecting the hairs of the pubis, then causing the infection. Okay, very gross, but then for understanding it's good to see the pictures so you can make a better diagnosis in the people. So that is pediculosis pubis. Then they're talking about scabies, which is caused by Sarcoptes scabies. It will produce the intense itching and also the excoriation of the skin. So you can see the scabies presentation here. Okay, this is scabies. Then we have the threadworm infection. The causative organism will be Oxyuris vermicularis threadworm. Okay. Then Oxyuris vermicularis. In threadworm infections, you can see the nocturnal perineal itching, and also there will be excoriation of the perineal skin. Moving on, we have the pyogenic infections which are non-gonococcal. The vulval cellulitis. The causative organism of the vulval cellulitis is Staphylococcus aureus. In the vulval cellulitis, the vulva will be swollen, red and tender. It's going to be very painful. And there will be profuse exudation present here. Then we have the patient who is complaining of the intense pain, itching, and there is problem in micturition as well. There will be excoriation of the skin because of the scratching and the laceration, which you can appreciate in the picture. The excoriation of the skin because of the laceration and the scratching. The treatment for the pyogenic viral cellulitis could be the systemic antibiotics. The local hot compress and the analgesics can also be useful. So the analgesics are given for the pain and antibiotics because it is Staphylococcus aureus, the infection, bacterial infection. Then we have the hot compress which can also give some relief to the patient. Then they're talking about furunculosis. Furunculosis is the affection of the hair follicle. So guys, you can see the hair follicles being affected in furunculosis. The hair follicles of the mons pubis. So we saw the picture, the mons pubis and the labia majoris. The hairs which are present on the labia majora and the mons pubis are going to be affected in furunculosis. First there is folliculitis, then progressing into furunculitis. So you can see the folliculitis in this picture and then the furunculitis. So we need to know what is folliculitis and furunculitis. How do we differentiate it? The folliculitis is actually a superficial infection of the hair follicle. You can see the number of clusters or the group of small bumps or the pimples which are seen around the hair follicles of the pubis. And then the pus-filled blisters which will break open and the crust will cover up. So guys, this is folliculitis. Now we're moving on to the furunculitis. What happens in this? It is a deeper infection of the hair follicle. Furuncle is another name for the boil. What happens in this? A pus-filled bump will be seen under the skin. It is usually infected and the hair follicle is going to be inflamed. So the offending organism in this is again Staphylococcus aureus. The treatment is systemic and local antibiotics and the cleanliness to be maintained. Then we have the infections of the sebaceous and apocrine glands. It will look like a feature of a boil. So we know a boil is a painful pus-filled bump which is seen under the skin. So the similar thing, the infections of sebaceous and apocrine glands will present like a boil. We have next thing, impetigo. Impetigo is a pustular infection which is caused by the Staphylococcus aureus or it could also be because of Streptococcus. Impetigo can be localized to the vulva or it can also spread to the other parts of the body, the face or the hands. So guys, impetigo starting in the vulva. Then from the vulva, it can also spread to the person's face and the hands and then body, the entire body, the impetigo can spread. The bleps, okay, the bleps which are formed should be incised, an incision should be given and the crust which is present in the bleps should be removed aseptically. So you have to take the aseptic precautions. so that there is no further infection. So you have to incise the bleb and remove the crust. And the systemic and local antibiotics can be prescribed in case of impetigo. So this is a picture of impetigo, where you're going to give a incision and remove this crust. It is caused by Staphylococcus aureus or Streptococcus. Then we have the next thing, erysipelas. Erysipelas is a spreading cellulitis. It is caused by the invasion of the superficial lymphatics by the beta hemolytic Streptococcus. So guys, the erysipelas is the superficial lymphatics. It is involving the superficial lymphatics and the superficial dermis. And then there will be systemic constitutional symptoms like headache, vomiting, fever, and all those. It will respond to the systemic broad spectrum antibiotics. So in erysipelas, you have to give the antibiotics, the broad spectrum antibiotics. Since the constitutional symptoms are involved, you have to give the systemic antibiotics. So you can see the involvement of the superficial lymphatics by the beta hemolytic Streptococcus. Then moving on to the next thing, that is intertrigo. It is commonly observed, okay, because of the unhygiene and everything. Intertrigo is the irritation or the hypersensitive people as well. If the skin is very hypersensitive, even though they maintain hygiene, they'll have this intertrigo. It is due to the irritation and infection of the retained secretions of the skin folds. So in the very obese patients, they'll have these skin folds where the sweat and the secretions are going to be retained, and this will result in the intertrigo. It can also result from the friction of the undergarments and also the sanitary towels or the napkins which are used during the menses. After each menses, they are going to have this intertrigo. So guys, hope it's clear. There is irritation, infection, and it is occurring because of the friction. The treatment of this intertrigo is maintain the local hygiene, and the local antiseptic application will be quite effective. At times we also require the antibiotics. Then we have the viral infections which are discussed in detail here. The herpes zoster, most of the things we have already studied. So we'll move on quickly. Herpes zoster, guys, what did I tell you? The causative organism, varicella zoster virus. The inflammatory painful eruption of a group of vesicles which is distributed over the skin. It is along the dermatome. A dermatome, a single spinal root, it is going to supply the nerves. Okay, the nerves are derived from a single spinal nerve root. So this is it is following the course of peripheral sensory nerves, that is dermatome. Herpes zoster, varicella zoster virus. It is commonly unilateral, but it can also extend up to the thighs or the buttocks of the same side. So this herpes zoster infection from the vulva, it is extending to the thighs, or from the vulva it can also go back into the buttocks, but it is usually unilateral. The vesicles which we saw in the picture, they can rupture and they also become dry with the scab formation. So after the rupture, what happens, or once this vesicles rupture in the herpes zoster, they are going to form a scab formation. It will resolve spontaneously in a 3-week time. Then we move on to the treatment of herpes zoster. You have to give the analgesics to relieve the pain of the patient, and the antibiotics are given to prevent the secondary infections. Acyclovir. So guys, they're talking about cyclovir. A cyclovir 800 mg orally 5 times daily for around 7 days is recommended. A cyclovir cream is also used locally for the less severe infection. So in herpes zoster, you have to remember acyclovir. So a patient comes with herpes zoster, you have to prescribe them acyclovir orally 5 times daily for 7 days, and even the cream, which is 5%. Moving on to the fungal infections, the ringworm infection, like I told you in the upcoming picture I'll show you, it is caused by Tinea cruris. The lesion is bright red and also the circumscribed. So you can see the circumscribed lesion here. You can easily make out the circumscribed lesion and also the It is bright red color. Fungus can be detected. This ringworm, it can be detected microscopically from the scraping of the lesion. If you scrape a lesion, observe it under the microscope, you can see the ringworm. The treatment effective is imidazole, clotrimazole or miclonazole cream. So they are talking about the imidazole cream here. Some fungi, Trichophyton rubrum, specifically this fungi, okay, Trichophyton rubrum will respond well to the Grisofulvin 500 mg twice daily orally for 4 weeks. So if the fungi detected is Trichophyton rubrum, then you have to give the Grisofulvin 500 mg. Grisofulvin 500 mg, and the cream is imidazole cream. For ringworm infections, imidazole. Then moving on to the parasitic infections, threadworm infection. The causative organism is Oxyuris vermicularis, like we dealt previously. It will be common in children. So we have the perineal itching, and also there is evidence of perianal excoriation. So we usually have this threadworm infections in the children. The worms will be present, resulting in the perianal excoriation, nocturnal perianal itching. The parasite can be detected in the stool. So we have to give them mebendazole or also albendazole, and the local application of gentian violet will cure the condition. Anti-helminthic drugs. So threadworm is a helminth. So this is a helminth parasite, helminth. So we require the anti-helminthic drugs like mebendazole, and gentian violet will cure the condition. So this is a threadworm which is found in the intestines. It can also result in the perianal excoriation when the eggs will be laid there. Thank you. With this we come to an end of the topic, vulval infections. Hope everything is clear. If you have any doubts, put it in the comment section, and if you like my video, hit the like button and subscribe.